Let's talk about how stress affects your health. Are you feeling stressed right now? Sometimes I get stressed too. I get stressed when nothing goes to plan. I get stressed when I might be running late for a meeting or an event, or running late to the airport and I might miss my plane. I get stressed when patients come to me with multiple problems which they expect me to solve in 10 minutes, which is usually allocated for just one problem. I can get stressed if I'm off duty and people are approaching me with medical problems when I'm off duty. I'm also stressed right now because you might be watching this video and you might think this is not a good video and you might switch off. Now, stress affects us in different ways and is how we have coping mechanisms to manage with the stress. Like, I've got my own coping mechanism and you might have your own coping mechanism. My coping mechanism might not be good. Your coping mechanism might be good. So stress is basically a situation that the body perceives as a threat. And when this happens, there's a cascade of events that happens in the body where basically the brain stimulates the stress hormones from the adrenal glands, which is on top of the kidneys. And these hormones are called your adrenaline and cortisol. These are your stress hormones. And these hormones are what's responsible for the flight and fight response. Now, cortisol provides energy for this fight and flight response because they help to increase the level of blood sugars in the bloodstream by stimulating the release of glucose from the cells. They help to reduce inflammation, they increase memory, they also control your blood pressure along with adrenaline, which is another stress hormone. Adrenaline increases your heart rate and your blood pressure. It helps to expand the air in the passage of your lungs. It sends blood to your muscles and it increases your body metabolism. And that's why, remember watching those movies and you can see the girl just running and running from the enemy, like in movies like Scream, for instance. The girl's running, cannot catch her. Or maybe in real life, you've had someone that you were running from and all of a sudden you just had this energy from nowhere where basically you're running from miles and miles on end and no one can catch you. Maybe you're a burglar running from the police, for instance. Or a better example would be when you see athletes, who are running and running, that's the adrenaline and that's the stress hormone. There are pros and cons, to utilization of the stress hormones. For example, as I mentioned, as an athlete, running 100-meter sprints, 200-meter sprints or doing a marathon. But the con would be if you had an injury, for instance, and because of the adrenaline, you're not aware that you have an injury, like a fracture of your leg, and you keep running, and when you stop, and that's when you can now feel the pain, because your cortisol and your adrenaline has now come down as your body starts to calm down and relax. Now, these are what we call an acute stress response. But what happens in a chronic stress, for example, which usually happens in a workplace where basically you might be stressed with work, stressed with your manager, stressed with your colleagues, you're in a chronic stressful situation, or it could be in a home, you're stressed with your kids, your partner, or whatever else is happening at home. You might notice that this cortisol and adrenaline are always high. So this means your heart rate remains high, your blood pressure remains high, the hormones are never switched off. So this means your metabolic and immune processes get disrupted, and this can lead to problems in the body. So we're going to talk about the various health issues that can be caused by stress. So I'd like to start systematically. I'll start from the head. For example, stress can lead to tension headaches, migraines, where basically you have reduced blood vessels to the brain, and you can get a migraine, which is usually throbbing pain in one side, intense eye pain. You have to go and lie in a dark room. You might be sensitive to noise and sound or bright lights. And you might find that simple painkillers like paracetamol or ibuprofen does not relieve your migraine. With headaches, they're more like tension headaches, where basically your muscles are going into spasm, and muscles go into spasm as a way to protect themselves, but what happens is you have tension in the neck, which now radiates all the way to the head, causing tension headaches. Now, stress can affect your mental health, on the side that you could have depression, anxiety. Now, in very acute stress reactions, which are quite severe, some people have had what we call acute psychosis, which is basically an acute stress reaction to an event. And that can present with having delusions, where basically you have fixed belief that something's happening to you, and you're so fixed in this belief that no one else can tell you otherwise. For example, you might believe that people at work are spying on you. People are watching you all the time, and even though your colleagues might say, no, we're not spying on you, you're convinced that they're spying on you. You might be convinced that the government is coming to get you, or police is coming to arrest you for something you've not done. You might also start hearing voices telling you what to do, or you might start seeing people that are not there, maybe dead relatives, for instance. And usually psychosis tends to be brief, shouldn't last for more than a month, but if it goes on for longer than a month, then you obviously might need medical intervention. Stress can also trigger what we call bipolar disorder, which is basically when you experience highs and lows. Again, psychosis, delusions, and hallucinations can all be part of bipolar disorder, and you can check out my video on bipolar disorder. Now, in the brain, stress does not directly lead to strokes, but there is a cascade of events where basically your blood pressure is high, there's not enough blood flow to the brain, which can then lead to strokes. So that talks about the head. Now, if we talk about, the neck, for example, shoulders, we're talking more about musculoskeletal pains, where basically you have neck, shoulder. Also, you have chest pains as well. So like I said earlier, your muscles go into spasms, they're going into tension, which is the body's way of guarding itself against injury. But what happens is when your body is in constant tension, that can lead to aches and pains. So you get tension headache, you get neck pain, you get shoulder pain, you get back pains, you get chest pains as well, which might be confused with heart attacks, for instance. So if you've come back from work and you're so tense, why don't you say to your partner, honey, why don't you get me relaxed? Give me a neck massage, give me a shoulder massage. I'm so stressed. Now, in the chest, you've got the heart. Now, this is what people are concerned about the most when they get chest pain, they get palpitations, they get breathlessness. These are all symptoms of anxiety. These are also symptoms that can present with a heart-related disease. As I mentioned, adrenaline can cause increase in heart rate, increase in your blood pressure, which means due to the rise in blood pressure, your heart has to work harder to pump blood around the body, which leads to a higher blood pressure, which can lead to conditions like malignant hypertension, strokes, and your heart muscle starts to become larger and harder as well, which means now it's not working as properly as it should do. So imagine a pump having to pump blood at such high pressure, and all of a sudden the pump is not working as properly as it should do. The pump starts to stutter, and that's what can happen with your heart, and that can lead to reduced blood flow, which leads to your hypertension, heart attacks, and strokes. So if you have any chest pains, make sure you see a doctor, because in some cases there is no way of differentiating, anxiety, a musculoskeletal chest pain, or a heart attack from each other, apart from doing blood tests such as a troponin, which tells you if there's any damage to the heart muscle, or other tests such as an ECG. Now, stress can also affect your digestion. High stress levels can cause increased acid production from the stomach, or some people believe that it actually makes your stomach more sensitive to acids, which can lead to acid reflux symptoms, where you get heartburn, bloating, burping, nausea, and you have that sensation of food constantly coming up into your throat. If this continues, that can actually lead to stomach ulcers. It is also thought that the stress hormones actually make your gut more sensitive to the bacteria, which can lead to symptoms of irritable bowel syndrome, which, as you know, can also be caused by anxiety. The stress can affect the movement of food through your gut, which can lead to diarrhea and constipation, and it can also promote inflammation of your bowel. So you get all sorts of symptoms of IBS, such as bloating, abdominal cramps, diarrhea, which can sometimes interchange with constipation. So if you have any of the symptoms, again, don't just assume that this is down to stress, because there are other reasons why you might have these symptoms, so you do need to see your doctor. Now, if we look at the reproductive tract in men, stress is known to cause erectile dysfunction, because what stress can do, it can reduce your testosterone levels, and also the adrenaline levels can make it difficult for the blood and the muscles in the penis to relax, which means that the blood doesn't flow to the penis, which can cause erection problems. And if you have reduced testosterone production, this would also affect your sperm production, which can also lead to fertility problems in the men. With the women, stress can cause irregular periods, where basically you've had a period every month, now you have periods in 3 months, you don't see your periods, or another 6 months, you don't see your periods. So stress can affect your menstrual cycle, which means you don't know when you're going to ovulate, which can also mean that stress affects your fertility in terms of how do you know you can get pregnant or delay in getting pregnant. Stress can also affect your skin in so many ways. Stress can cause skin problems such as acne. So some people have noticed that when they're more stressed is when they have breakouts of acne. Stress can also cause flare-ups of conditions like eczema, psoriasis, as well as dermatitis, which is basically inflammation of the skin, which can cause dryness, cracked skin, scaly skin, and inflammation where the skin can be quite painful. So these are some of the ways that stress can affect your health. We've gone from the top to the bottom. So if you have any of the symptoms and you've noticed that these are due to triggers such as stress, you need to speak to a doctor. You also might need to speak to someone such as a psychologist, for instance, because though you might have medications for irritable bowel syndrome, for instance, you might need psychology to help you deal with the underlying problem, which is stress. And also, you might have bad coping mechanisms, like when some people are stressed, they smoke, or they might go and drink alcohol. Now, these are bad coping mechanisms that further affect your health, because as we know, smoking can cause lung problems such as lung cancer or COPD, while alcohol can cause, brain damage and liver damage as well. So it is worthwhile, speaking to someone who can help you manage your stress. I hope you enjoyed this video. If you want to watch further videos, please subscribe to my channel.